Hi, Matt Rayner here again from Healthcare Innovation, live at the Southern California Healthcare Innovation Summit. And I am so excited now to be joined by the Editor-in-Chief from Healthcare Innovation, Mark Hagland. Mark, I was hoping you could share with our audience a little bit of an in-depth look as to some of the key areas you and your team are focused on when you think of 2020 in healthcare.
Well, great to be here with you, Matt. I really appreciate it. And we're having a tremendous time at the Southern California Healthcare Innovation Summit. So one of the things I talk about when I speak publicly is right now, everything in healthcare is being driven by payment and policy. The Medicare actuaries keep reminding us that we are about to add 60% to the annual cost of healthcare in this country. We're about to go from 3.6 trillion a year to 6 trillion a year in the next 6 years, which is completely mind-blowing. So that is really pushing everything because the purchasers and payers of healthcare are saying it's too expensive and they're not getting enough value. So how do we fix that? Fundamentally, it's about population health management and care management and really leveraging healthcare IT tools and solutions to make that happen. So essentially what we're talking about is hospitals, medical groups, and health systems learning how to look under the hood and really figure out what's going on with patients, particularly those with chronic illnesses, and go upstream and intervene early on so that a diabetic, for example, with uncontrolled blood sugar is looked at early. A person who is living with congestive heart failure is monitored very closely. A person with coronary artery disease is monitored closely. All of those things. So everything that's happening right now is really related to that. It's related to moving upstream, intervening with patients as early as possible, and leveraging all the data analytics and IT tools to help make that happen.
That's excellent. Sounds like you and your team are going to be pretty busy this year.
We will be, and we've got a lot going on, which is very exciting. Population health, policy. We're also really digging into cybersecurity, which is such an interesting area because on the one hand, you've got more and more data being shared by more and more individuals and organizations appropriately in healthcare. And yet at the other end, the threat vectors are accelerating dramatically. And data is more imperiled than ever. And some of it is PHI. It's actually personal health data. So providers are in the most kind of excruciating position where they will have to be sharing more and more data with each other. And at the same time, we're going to have to really find new ways to secure that data as the threat vectors rise. So we're living in an interesting moment right now.
Yeah, we truly are. I want to thank Mark for joining us today. If that content that he has shared sounds of interest, please join us at one of the Healthcare Innovation summits that we have scheduled here in 2020, or join us at one of the co-located cybersecurity forums. Mark will be at all of them, as will I and the rest of the Healthcare Innovation team. Thanks for joining us.